So I was asked to talk about innovation and how you make innovation deliver an impact. And I've been doing that. I'm old. You know, she said I'm the father of digital health. John Nosta said that. That's actually not true. I'm the grandfather of digital health. I have grandkids now, so you know, I'm old enough. And why should I do this? By the way, bow tie, it's how I roll. Dan said no suits. I'm not wearing a suit. So I began over 40 years ago at Duke, where I was in medical school and biomedical engineering grad school. And because of some family health issues, I accidentally became an inventor. And I've got, you know, I actually have some opinions. And even the President of the United States sometimes agrees with my opinions. So this was my first peer-reviewed paper. It is 40 years ago, 1983. Does anybody know who the second author is? That's the commissioner of the FDA, Dr. Rob Califf. So Rob actually taught me how to write papers, and that's a pretty good coach. And this is my first patent 40 years ago, a wrist-based heart monitor with an array of pulse tonometry sensors. If you go in and you see LifeMetric, you'll see something that is a modern version of what I did 40 years ago. But that's then. This is now. Alivecor began in 2011, and today we have over 3 million lifetime customers. We have 1 million people every day. In fact, every week we receive over 1 million ECGs into our cloud. We have 190 plus peer-reviewed publications, and we have over 190 million ECGs in that cloud, again, going up 1 a week, 1 million a week. Well, this is the idea that I had for Alivecor. It was in 1996. I had a company called Data Critical. Ultimately, it sold to GE Healthcare in 2001. But I got a patent. I got an FDA 510K. I built a product, and we never commercialized it. Why? Because it was a Rube Goldberg mess. It had wires and cables and a pocket PC and a cell phone. It was not a practical solution. Fast forward to 2007, when that eureka idea and the notion of, oh, by the way, Steve Jobs saying one more thing, and we had the smartphone. The smartphone is the remote control for our lives. We bank, we travel, we monitor our health, as Mike Snyder talked about. It is the center of our life. You walk around, I was just on the subway in LA, I live in Santa Monica, and everybody on the subway is looking down. Almost everywhere you go, everybody's looking down. And I took advantage of that in 2010. People told me, oh, by the way, people who need heart monitoring, they don't have smartphones. That was then, this is now. So, how did I come up with this idea? Well, I have a notion of I call orthogonal thinking. And that is, I reject conventional wisdom and I try to look perpendicular to what everybody else is doing and thinking. And that gives me the opportunity to see things in a new way and to do this thing called innovate and invent. And so that happened, built a smartphone case, made a 4-minute video that I sent to 3 people. And I just happened to upload it. When I uploaded it to YouTube, I happened to click send to my LinkedIn connections. 2 days later, I had 400,000 views of that video, and it became viral. And this was a virus, unlike COVID, that was actually beneficial. So in 1924, Wilhelm Einthoven won the Nobel Prize in Medicine and Physiology for the first practical ECG machine. That's on the left there. And you had buckets of salt water were your electrodes for the left and right hand and the left leg. And today, we can give you the same 6 limb leads using a device you hold in your hands and on your knee. That's where we've traveled in almost 100 years. But when I first started Alivecor, we didn't have an FDA clearance. So what did we do? We sold it to veterinarians. And here are some dogs, cats, horses. In fact, today, Almost every track veterinarian around the world uses a Cardia device because racehorses get atrial fibrillation when you train them too hard. But as you can see here, that's in the Cincinnati Zoo. They trained a gorilla who happened to have an arrhythmia. Hey, I'll give you a banana if you put your fingers on the Cardia. And so these are just some of the many, many kinds of animals we used the first year. We innovated our business model before we had a 510K. So then, what happened? Well, we got a 510K, we began selling, and as everybody knows, we have a few customers. That's one of our customers. I don't know if you know that guy, but you can look on the back of his phone, and what does he have? He has a Cardia. And I can tell you, we got to where we are today when we have the world's biggest companies as our competitors, and we are growing exponentially on three basic ideas: clinical validation, and clinical validation. What do you think I base our success on? There's a hint. So, does everybody know what the FDA actually regulates? Well, they regulate your claims, but they regulate on the basis of safety and efficacy, and you've heard that before. You have to prove both to them when you have a new innovation. And I would tell you that evidence-based medicine and clinical practice guidelines are things you cannot ignore. Workflow are things you cannot ignore, even if you're coming outside the established medical practice. So what have we done? Well, I told you we have over 190 peer-reviewed publications. Here's our first published study, was an abstract at the Heart Rhythm Society, and this is one of our more recent ones in June of 2022, compared our device to a device from some unknown company, and that's our 6-lead ECG. We publish, we support research, we validate every innovation we do, and that's why we're able to compete with anyone. That's why Mayo Clinic is an investor. That's why GE Healthcare is an investor. That's why Qualcomm's an investor. And that's why Omron, the people that make all the blood pressure cuffs, are all investors in Alivecor, because they know we are the clinical leader. And so this is another paper. It was from last summer, showing comparative rates of AFib diagnosis. We know more. Why? I got 190 million ECGs. About 15% of those are AFib. What's that mean? That means 25 million AFib recordings from over 1 million different people. That's big data. That enables machine learning. That enables deep neural networks that perform better than a cardiologist. So this is another one of our papers. This shows that we're not just limited to atrial fibrillation. This is something called QT. Now, most of you probably don't know what QT is. QT is a measurement of the EKG, but it's very important. As a matter of fact, during COVID, remember when people were telling you to go take hydroxychloroquine and azithromycin? That's Plaquenil, and that's a Z-Pak. Well, both of those medicines actually prolong the QT. And if your QT is prolonged enough, you can have sudden cardiac death. And so monitoring your QT is very important. Today we're involved in studies. UCSF has one in South Africa. Why? Drug-resistant tuberculosis. All the drugs used to treat it are serious QT prolongers. Methadone, serious QT prolonger. Every antipsychotic medication is a QT prolonger. So lots of opportunities. You don't want to have to bring people into the hospital to just do one measurement. You want to be able to let them live their lives. And so, in addition to medical efficacy, you have to have economic efficacy. We've talked a lot about it. You know, healthcare in the United States is incredibly expensive. And so to be an innovator, you need to innovate economically, not just clinically. And this shows you, we've actually had studies that we weren't even involved with. This is from Jefferson University in Philadelphia that showed that by using Cardia, they could keep people out of the emergency room and they could keep people out of an urgent medical visit, saving real money, helping those patients to live better lives. And these are some of our many partners. I told you Mayo Clinic's an investor, but all of these are active Cardia users. And all of these drug companies were involved in many, many drug studies all over the world with the world's leading pharmaceutical and CROs. And of course, I'll be honest with you. Yesterday I had 4 people come up to me and tell me about how they've used Cardia to help their own family. It made my day yesterday. That's at this meeting. So we have people every day who message us saying thank you. And that makes it worthwhile. So this is our path of innovation. Some of you may have seen the card on the right. You can come up and see me. It's a credit card, literally the size of a credit card. It's the thinnest EKG in the world. And it has microprocessor, Bluetooth, analog electronics. And this is it. You can see how small it is. But this is the future. The future is, instead of having to go to the hospital, we'll be able to diagnose you that you're having a heart attack anywhere and any time. That's innovation. Thank you.
Hello, let's have a little chat.
Okay.
Wow, tremendous. So you're the OG tech go viral person. You were really creative when it came to finding an early niche with veterinarians.
Innovating a business model.
That's right.
Okay? When you're broke and you have limited resources, you have to find a way.
Yeah, completely. And I think that's really good insight for those out there with startups. There's never no, it's just finding that other way around. And it's been incredible to see over the last decade how you're already tiny technology has just continued to shrink. So amazing. I know as a pharmacist, we were delighted when we did a pilot using the Cardio Mobile where pharmacists were able to test and do an early detection and referral. So there's so many use cases for your technology. Certainly it catches my attention when you talk about the QT wave prolongation. So you can
certainly pharmacists understand that. I mean, we want to help people practice at the top of their license, whether they're a nurse, a pharmacist, a physician, a PA. And we want to bring healthcare to the individual. So
absolutely.
Everyone can innovate.
That's right. So one final tip for those out there innovating in your shoes, what would be your singular recommendation?
Think different. And that was what Steve Jobs said. And by the way, it's really think differently. But by saying think different, he gets you to think. So, ladies and gentlemen, go out and innovate.
Beautiful.